Mental wellness is just as important as physical wellness, and in some cases, these two categories can influence each other. In this episode of Being Well, I'll sit down with Horizon Health's Dr. Bill Elliott and discuss suicide and non-suicidal self-injury.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are welcoming back a friend of the show who was here just a few short years ago. We are welcoming in Dr. Bill Elliott from Horizon Health. Welcome back to Being Well.
Thank you very much. Pleasure to be here.
We're so glad that we get to welcome back in such knowledgeable folks. Usually when they knock it out of the park the first time, we have to have you back. So anyways, for our folks who maybe didn't get to meet you in our COVID special a couple of years ago, can you kind of introduce yourself, tell us a little bit about your background?
Sure. I'm a licensed clinical psychologist and have been working with Horizon Health for the last 2.5 years. Prior to that, going all the way back to 1974, I worked in the correctional system, working primarily in state and federal prisons as a psychologist and in other management positions. And I still, to this day, do a lot of consulting and training throughout the country in different correctional venues. But I devoted most of my time this last couple of years to outpatient psychotherapy at Horizon Health.
That has to be quite the switch.
It is a switch, and it's been very, very gratifying. I get to work with people who are a little bit more motivated to change and a great variety of mental health issues, a lot of interpersonal relationship issues, family issues, and so forth.
Well, today we are diving into a topic in the mental health realm, very important. We'll be talking about suicide and non-suicidal self-injury. I think a decent place to start would be how prevalent is suicide in the U.S.?
Well, completed suicides, meaning that the person has actually died, in the United States, the best data we have is around 48,000 people have killed themselves, going back to 21, 22 for the best information. Now, that's an awful lot. If a viewer can think of a city or a town that they know that has a population of 40 to 50,000 people, I mean, that's really like wiping that town off the face of the earth. And that's how I like to keep it in perspective. That is a bit of an increase over just a few years ago, when it was closer to about 40,000. Worldwide, roughly 800,000 people kill themselves every year. So this is a universal problem. It is a problem that mankind has struggled with since recorded history. Now, that's for completed suicide, but the other thing that may be important for viewers to understand is when we talk about suicidal behavior, we're really talking about a spectrum, a continuum, starting with just fleeting thoughts of not wanting to be here anymore, which are very transient, come and go quickly, all the way up to completed suicide. And in between there are two major dimensions. One is called non-suicidal self-injury, where someone doesn't really have an intent to die, but yet finds some comfort, some purpose, some reward in harming themselves. And then, of course, attempted suicides, where the person wants to die but is not successful. And that represents the most significant risk factor for a future suicide.
Okay, so it's definitely something to keep in mind. Before we go any further, as far as talking about categories of folks, what type of demographics are being impacted by this the most?
All right. One of the things that's been standard since we've had data recorded for suicide is the fact that men are 3 times more likely to kill themselves than women.
Really?
Now, a lot of that has to do with access to and ownership of firearms, which are, by definition, extremely lethal. Women rarely use firearms when they attempt to harm themselves. Interestingly, one of the most robust findings for decades has been older men, and by that I mean over the age of 65, represent the highest risk group. There are some pretty important reasons for that. What is alarming is that over the last quarter century, there's been an alarming increase in youth suicide, and by youth I mean ages 10 to 24. That kind of 14-year range usually represents what we mean by youth.
So with this, what are some of the factors, the personal factors that may be influencing this? I know you said means access to firearms for at least the older demographic, but what kind of shift are we seeing societally that is maybe making this ideation more of a reality?
Well, that's a great question, and again, as a psychologist, I have to be careful to draw a distinction between causes and correlation, association.
Okay.
Because we really can't say with certainty what causes any individual to kill him or herself.
Sure.
There are unique aspects of their life that we may or may not know about. There are various risk factors. There are warning signs. There are a number of things that could clue us. But we do know that for the youth group, for example, clearly social media, which carries both positive and negative influences regarding suicide. There are websites that, teach how to kill yourself, how to avoid being found or caught, glorify or normalize suicidal behavior. But then there are a number of very important sites for kids that also talk about alternatives, talk about seeking help, talk about disclosing it to a friend or a family member. During the COVID era, clearly the social isolation was a big issue.
Yes.
Within the family, greater exposure to family violence and family conflict. Those are just to name a few of the things that may be driving this. But it's important to understand that this shift in youth suicide goes back to around 2007.
Is that just where the data's at, or?
That is where the data shows a 62% increase in youth suicide between 2007 and 2021.
Wow. So on this topic, there's a distinction between non-suicidal self-injury and then suicidal behavior. So can we talk about what both of those look like so that we keep them straight?
Yeah. Someone who engages in truly suicidal behavior has made a decision that, for whatever reason or reasons, life is no longer worth living. Now, my experience has been that there are two major factors when someone makes a serious attempt. The first one is loneliness, a lack of sense of belonging, not being loved. And then the other one is, and this is why we find older men at high risk, lack of a sense of purpose or meaning in life. And in fact, one of the great people who has written extensively about suicide, Thomas Joyner, uses the term perceived burdensomeness to refer to the fact that the individual feels like he is, it's typically a he, is just a burden, and the world would be better off if he weren't in it any longer. Now, those two things, plus some prior experience with death, dying, or injury, which takes away the fear that many of us have of the pain. You know, one of the great deterrents to people killing themselves is the fact that they're afraid of the pain involved. But if that's not an issue for you, let's say a police officer or a surgeon, someone coming back from the military, they're not really afraid of pain. And so if the other two factors are present, we have a real problem.
And so when it comes to all of these things, it almost seems like you can never seek help, you can never reach out too early. But if someone is, struggling to take that step, there might be shame involved. There shouldn't be. We want to love on our people, but if we don't know you're hurting, you can definitely miss these things. So what as a family member, what can you maybe try to be looking out for to try and help them?
That's a good question. The first thing is to legitimize, normalize talking about mental health in general within the family, or within the community for that matter. And then to understand that the word suicide is not going to in any way prompt someone to start thinking about killing themselves. If someone has suicidal thoughts, they're already there. The best thing you can do is get it out in the open, to have frank conversations. Now, the hardest thing for people, and even people in mental health, honestly, is that we tend to overreact and threaten to hospitalize someone.
Yeah.
That shuts the person down typically. And this is the hard thing to do, but the most important word in all of mental health is validation. That is, I understand that right now you feel like life is not living. I respect that. Let's see if you can tell me a little bit more about that and see if maybe, there is another way that you can approach whatever problem you're having. Never saying, I will not let you kill yourself, you can't kill yourself, threaten hospitalization, although that may be necessary down the road. But that's important to make it safe to talk about, because most of the time when we catch it, we can intervene and rather quickly help the person come up with an alternative.
Validation obviously sounds great in theory, and I don't mean to step on toes, but if I have a close loved one who tells me that they're having these ideations, I think panic would go through my mind. So as I'm trying to provide this validation, at what point am I not qualified to continue this conversation? When should we see what those next options are?
Well, obviously one has to be conservative and safer rather than sorry. So I think that when someone tells a family member that he or she is having suicidal thoughts, it's time to pick up the phone and seek mental health treatment. That doesn't mean the person has to go to a hospital, but it means getting in touch with a school counselor, a community mental health center, a place like Horizon Health, where we have a full-scale behavioral health team. And there are places such as the living room at Horizon Health where someone can go in anytime and just in effect check themselves in for a period of time and receive some sort of counseling. But yes, you definitely want to act, but at the same time, we have to avoid communicating any punitive kind of reaction so that the person feels this is a bad thing that I shared this, and I'll be darn sure I won't share it again.
So it seems like that line is obviously very delicate, just to lay that out there. There's a national hotline number as well. Is it 988? We'll be sure to put it on the screen.
Yeah, the last four numbers are TALK, T-A-L-K, the National Suicide Helpline.
Yes.
But then there's nothing wrong with dialing 911 and getting emergency services, and then hopefully work one's way into the mental health domain.
So pivoting over to talk about self-harm. So what kind of things are folks are taking in? What should we be on the lookout for? What age groups? All of them, I mean.
Non-suicidal self-injury is a fairly recent term.
Okay.
And it is not an official diagnosis at this point. However, there is a lot of support for the next time the Psychiatric Psychological Bible is revised, it will probably be there because we find that it cuts across almost all mental disorders. And typically, it's found with those with borderline personality disorder, one of the main characteristics of which is hurting oneself, cutting, head banging, reckless behavior, and the purpose for the individual is not to die, but it's to find some way to relieve pain. For example, we find that many adolescents are cut on themselves, see the blood flowing, and it gives them a feeling of control over whatever the situation is. And it also provides some relief at a neurochemical level too. It appears bizarre behavior to others, but yet it's something that they have found gives them temporary comfort. Now, it's temporary. The problem they're trying to get away from is still there. So as a long-term strategy, it's not effective. We do know, though, that it is a risk for eventual suicide. About 8 to 10% of people with borderline personality disorder, sadly, will go on to kill themselves. Sometimes it's accidental because maybe they've hit an artery instead of a vein. But it is something that is often dismissed because it's a nuisance behavior. I'll give you an example. In the prison or jail world, an inmate might cut on himself, have to go to an outside hospital, costs the taxpayers a great deal of money. Everybody involved, even the ER nurses and doctors who treat the person, get tired of them. So they tend to regard them as, quote, manipulators, unquote, when in fact they're suffering pain and have chosen a pretty ineffective way of dealing with it. They are at risk for eventually, though, killing themselves, whether accidentally or finally becoming truly suicidal. So it's again a fine line. And I always tell people today's so-called manipulator could be tomorrow's death due to suicide.
I mean, that has to be so difficult to navigate because, like you say, I mean, if it's a repeat person, you know, but that doesn't mean that they're any less deserving of your attention, your diagnosis, moving forward with care, I guess.
Quite so. And speaking of diagnosis, it's probably worth pointing out that one of the main risk factors for suicide is having a major mental disorder. I mean, interestingly enough, though, we think of people being depressed as at high risk, but in fact, actually bipolar disorder, what used to be known as manic depression, is the highest risk disorder for suicide. And typically it's when a person is in the manic state and he's getting pressure to take medicine which will level him out, but in fact, one of the characteristics of bipolar disorder is that the mania is fantastic. You feel on top of the world. You feel like Superman or Superwoman, so why would you want to go back to baseline? And then as they begin to feel less euphoric, they become at very high risk.
So what are the evidence-based treatments for suicide, for self-injury?
It used to be thought that suicide can be treated by treating the disorder that the person has. For example, if you have major depressive disorder, if we treat you with psychotherapy and medication, you won't be suicidal anymore. That's not true.
Okay.
There is a unique private logic that people have that's the way they frame things to make it legitimate to kill themselves. And it's very hard to get inside of that. But we do know that if we target, for example, cognitive behavioral therapy, which essentially means we look at thoughts and behaviors that are not working for the person and attempt to replace those. For example, we challenge irrational beliefs, we give people other ways of looking at things, and then to look at more constructive behaviors that might meet their needs. That has to target suicide specifically. So there are a number of cognitive behavioral therapies, and then for attempted suicide, there's an interesting treatment that's 4 sessions with follow-ups for about 2 years that focuses in on the attempted suicide. Because every time one attempts suicide, their risk for future suicide goes up for up to 20 years.
Wow.
Every subsequent suicide attempt keeps raising the risk that they will eventually succeed because they have framed it as a legitimate option to solve their problems. And then, of course, for some cases, there is no medication that treats suicidal behavior specifically. But again, to the extent that it's a product of a disorder like depression, bipolar disorder, schizophrenia, medication treatment for the disorder is very helpful too. But the gold standard for treatment of mental health problems, for the most part, is the appropriate medication and psychotherapy.
And so we're in our last few minutes here. As far as getting into those types of sessions, getting connected with a provider such as yourself, how does one go about that? Are they referred, like as they're in maybe an emergency room after a failed attempt, or how do they make that connection from maybe I don't even have a primary care doctor to getting into a specialist?
Well, you just identified the main pathway, and that is through their primary provider.
Okay.
Now, any walk-in clinic will be more than glad to refer someone for mental health treatment. If it's an adolescent, if it's a youth, the school system certainly has those kinds of pipelines. Direct self-referral. You know, as I said, I mentioned the living room at Horizon Health is a place where anybody can walk in off the street literally and present for health, and then they would be referred from there. But the main thing I go back to is that within that family or within that peer group, getting help has to be normalized. There's still, although we've come light years, there still is a bit of a stigma about getting treatment for mental health problems, which you don't find with people getting problems for medical or physical problems, right, particularly for men. And if I had one thing to say, it would be men be willing to ask for help, because that is the population that is typically at higher risk for completed suicide and other really negative outcomes.
Very well put. I don't think there's any better way to end our episode. Dr. Bill Elliott, thank you so much for shining a light on this, and we can't say thank you enough for trying to validate these feelings.
Very great pleasure. Thank you for having me.
Of course, and we thank our viewers for joining us for this episode. Just know you are loved, you are valid, you are important, and if you need to seek help, that is A-OK. We thank you for joining us for this episode, and we hope to see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.